why does my baby have jaundice? So two main reasons that we see jaundice in these newborn babies. First is newborns break down a lot more red blood cells than older kids or adults. Bilirubin is a protein in the red blood cells that spills into the bloodstream. So you just are creating more bilirubin that's free within your system. The second reason is that your liver as a newborn isn't quite ready to process those proteins. So a normal, healthy, mature liver has enzymes that process bilirubin, help the body get rid of it. Your liver's just not ready to go through those first few days of life typically. So the combination of those two factors, bilirubin can really increase. Bilirubin's kind of funny. It shows up as jaundice, a yellowing of the skin that starts usually at the top of the head. The eyes will turn yellow, and it can continue to progress and get all the way down onto your baby's chest or belly. If you're getting solid yellow color onto your baby's chest or belly, there's a good chance that bilirubin number is getting too high. Bilirubin, again, that's too high can lead to some permanent staining in the brain. That's what we want to avoid. Bilirubin builds up over the first 4 to 5 days of life. So most hospitals will check a baby's bilirubin between 24 and 48 hours, and it gives us a good idea of where that bilirubin is headed. The peak, again, usually is at about day 4 or 5. Things you can do to help your baby not have problems with jaundice. First is to continue to feed your baby. So every 2 to 3 hours, we encourage feeding those newborns, trying to get them a little bit of food. That food will help flush your baby's system. They poop out the bilirubin. That's the major reason why those newborn poops are so yellow. And so a baby that's not eating and not pooping is more likely to have bilirubin levels increase. So keep feeding your baby good. Sometimes your pediatrician might even recommend that you start supplementing your baby to try to help with that process. The other thing that works is a little bit of sunlight. So if you're able to get your baby into a diaper, sitting in a windowsill, something like that, if there's sunlight outside, those UV rays will actually help process bilirubin, converts it to a form that's easier for your body to get rid of. So those things can be helpful. If numbers are getting too high, your pediatrician might order bilirubin lights, which is basically a tanning bed that you'll put your baby in over the course of a few days. That again will help with that process of transitioning the bilirubin to a form that's more soluble and can get out of the baby's system. So your baby might end up in a little tanning bed. Sometimes they love those, sometimes they hate them, but they can be an important part of preventing kernicterus and brain damage from